So what are the top 5 reasons that men decide to go on TRT, testosterone replacement therapy? We're going to discuss it after this, so keep watching. Hi, I'm Mike, the founder of Balance My Hormones, where we help men and women on their journey to optimal hormone balance. If you're new to the channel, please consider subscribing and leaving comments, and we'll be happy to discuss in future videos. So today I'm here with Dave Lee. He is very knowledgeable on the topics of TRT. He does TRT coaching, as we do here at Balance My Hormones. And we're going to discuss what are the top 5 expectations men have when starting TRT. So we came up with the top 5 reasons, and I think the number one that most men would agree with would be men are suffering from low libido, low sex drive. Yeah. So what have you come across with people you've discussed?
Generally, what it pops up as, and I mean, I'm sure you could echo this as well when you've talked to guys, is guys just being very indifferent about, sex. Being like they could go a week, 2 weeks without it, not really think about it whatsoever. Not really having that, attraction, and not really having that kind of presence in their life in terms of drive. And I think this is a really big one because as a lot of men know, that sex drive that we have, we can translate that into other aspects of our life, our motivations, our passions for things. So when you lose that drive, particularly sexually, it can very much dampen your quality of life and your output. So it's low testosterone is not the only thing that would cause low libido. Absolutely, and that's one of the big mismanaged expectations that some people have. But I would say a low libido that is not responding to other lifestyle interventions and so forth is a big reason why a lot of guys are seeking out TRT.
So you said low libido is not just tied to low testosterone. There's so many other factors, and I think some of those factors are elevated prolactin. You might have too low estradiol levels. What else? What else have you come across?
I would say the biggest one is stress. And stress can manifest as that elevated prolactin, and then you can also take into account like metabolic stress. So being obese is a big factor as well. Like I would say that stress is the biggest factor, and then unfortunately, when testosterone is implicated and low testosterone is a factor, that will increase someone's disposition towards being stressed. So it creates this they call it a positive feedback loop. I call it a cycle, but I would say stress is the number one factor that would impact someone's libido, both on TRT and off TRT.
Times I've been most stressed, that was the last thing on my mind, but it didn't mean that was going to last forever.
Absolutely. And then people notice that libido comes back into overdrive when they go on holidays and stuff.
Yeah, the holiday halo, or when you go on holiday, you're like, oh yeah, it's great, no problem then. So yeah, life and stress do make have a big impact on libido. Right. So the next one reason why men start TRT would be low energy.
Low energy. Yeah, that's a big one. So, not feeling rested when they get up in the morning, but also at the same time not sleeping well, big one. Not having the energy or the drive to go to the gym after work, or not having any kind of spark for life or zest for getting out and doing their hobbies, all these kind of things. And again, there's a lot of factors that can impact that, of course, but this chronic low energy of state of always feeling exhausted. I call it being emotionally, physically, and spiritually drained. It's like your life force is just gone. That's a big factor that I see guys go on TRT for.
And as we discussed in the previous video, sometimes this low energy can also be related not just to testosterone, but can also be thyroid related. And sometimes even, and it's rare, but even low cortisol, right? When people are more tired in the morning, the cortisol levels could be quite low.
Yeah, absolutely. And it's why it's important that people check everything. So like, I'll always check like liver function. I'll always check every hormone in the body. I'll also go through, diet, lifestyle. What is this person actually doing with themselves? All of these factors are a huge, huge importance. But yeah, the low cortisol stuff I find is quite rare. It definitely does happen. And putting more testosterone into a low cortisol environment is not going to help anything.
Yeah, that just will suppress it even more, which is why we test cortisol on all our patients before they start TRT and during, and it has made a difference. We can sometimes pinpoint those who aren't going to get on well with it because of that low cortisol levels.
Yeah, and one of the biggest ones I'll add in for that low energy thing that often goes massively ignored, and I'm usually the one who picks it up, is non-alcoholic fatty liver disease, because it causes this symptom of malaise, and that's a medical term for just feeling like crap all the time. And that is a huge one why people are just having this chronic just feeling of just yeah, just feeling just crap. And that is one that always goes missed. And it's one of the reasons why before you go on TRT, it is so important to do a comprehensive metabolic panel. Don't just look at your testosterone and go, oh, it's low, I need TRT. Don't look for someone who's just going to give you TRT because you asked for it. You want someone to sit down and assess all your lab work, diet, lifestyle, and go, is this actually going to solve your problem? Because if low testosterone is not your problem, then will more testosterone make you feel better as a man? Sure, it'll make you feel a bit better, but it's not going to fix the root cause issue.
I mean, we have all those on our panels that we normally run patients through, so all those markers are there, and we do try to look at holistically what's going on with that. Right, the next item that why men start TRT would be that basically we get this complaint that men aren't responding to normal amounts of exercise. Either they exercise and they just feel knackered, or they're exercising with weight training and they're just not seeing the results of either fat loss or muscle improvement. So
that's one of the biggest ones I see, particularly for the younger guys. Like I see these guys who like they've researched the absolute oblivion. I'm trying not to swear. Researched the absolute oblivion out of every type of progressive overload training. They have they've tried every possible diet intervention. They've basically biohacked themselves into this amazing source of knowledge on doing everything right, but they're not getting any results. They're constantly plateauing at like a very poor kind of strength level, but they're just not recovering. Like they go, oh, let's say they're doing like a push-pull leg split. They're training, hard, but, kind of conservatively, but like they are wiped out for like 2, 3 days after they train. Like they're not able to pull up the next day after training. But the big one is that they're just not putting on muscle and not getting stronger, but they're doing everything right. That's the big one they find. And then they go, oh, okay, well, I mustn't be training right. I mustn't be eating right. So then they exhaust that to the nth degree, but they get nowhere.
and these same patients I've seen when they do start TRT, all of a sudden, because they were doing everything right, they're seeing really good progress in a short period of time, and they're just amazed that wow, it's finally doing something.
That's exactly what happened to me. I remember when I started TRT, I was so stoked because I was like, now these programs, because I always wondered, I'm like, why don't these programs work for me? They work for everyone else, but not for me. And I just kind of accepted that. And I remember I just went back and went, we're just going to go back to basics. I'm just going to do 5x5. And I ran 5x5 for like 2.5 years. Didn't hit any plateaus because I knew how to periodize. I knew what to do. But I mean, I made a huge amount of strength progress because I went, okay, I know how to play the long game. I know how to lift properly. I know how to do all these things right. Now I've just got to follow this systematic approach that I know like the back of my hand.
Yeah, no, that's a good point, and that sounds like a good exercise. I suppose it's a little bit like the CrossFit. Some people do the more competitive side of it as well to kind of to gain those skills. Okay, out of the 5 reasons men start TRT, the next one is depression and or anxiety. Is something that's felt by many patients at start. So I mean, depression is kind of rife, especially coming out of the pandemic and even before, and living in the modern world. As is anxiety, something that you hear more and more about. And we do know that signs of low testosterone or hypogonadism are linked to depression and or anxiety. So what have your experiences been coaching patients, coaching men about this?
Yeah, I think depression and anxiety is debilitating in a lot of ways. And I think that what people need to do is accept the fact that they can do something to change it and that their brain is not, they don't have this is the vast majority of people. Some people do have major depressive disorder, they do have issues with the brain. That's a very, very small portion of people who do get diagnosed with this. So for the majority of people who are just like, the reason why I got into doing what I do is I wanted to work with the people who were low grade suffering, not the people who were suicidally depressed and having an awful time, because there's a lot in place for those people. But I want to work with the people who wake up every morning and just can't be fucked getting out of bed just because it's just there. And that's the group that I wanted to work with because all the treatments for them are too heavy handed. They're not suitable. But what this group of men, in my opinion, really, really need is firstly, they need to assess their life. If you're living a depressive life, you're going to be depressed. Like that's just the way it is. But if you're doing all these things right, and if you're doing everything in the world that you should be doing, or you're living on your purpose, and you've got a sense of community, you're getting good nutrition and exercise, and you're doing all these things, and you just feel like there's something off and something's not quite right. And I think that internal intuition is very important. The first thing that you do is go out and get yourself some blood work and have a look and go, is there something in my biology that is causing me to feel this way? Because I don't want to get too esoteric, but the human consciousness is very aware of what's going on internally. Like one example for me is like I used to have a pinched nerve in my neck that would cause pain. And when that was flaring up, I would psychologically feel like crap because of what was going on in my body. That inflammatory response was making me feel awful. So when I got rid of that, I noticed my mood was so much better, as it should be. And what a lot of these guys are going through life with is this, low grade depression, anxiety. When left unresolved for months and years, they end up going into leading a more depressive life because they're not going out and doing their hobbies. They're not motivated. They're not ambitious. They're not making anything of themselves. They don't have any long-term goals. So they end up just kind of, treading water and kind of dawdling in this existence, which doesn't really serve them or anyone around them. And it's I like to refer to anxiety as either stress or learned fear. And I think when we look at it like that, we can go, okay, well, what are you afraid of, or why are you so afraid? And if it is a biological thing, like, if there's trauma or there's something there, then that can be addressed. But biologically, if a man is feeling down and low motivated and fearful and stressed about nothing, which would be called generalized anxiety disorder, like you're constantly just going out in the world and you're constantly worried and you're constantly anxious and you're always afraid, and you've got low testosterone, what you're missing is you're missing that buffer to stress. You're missing that thing that makes going out and facing those stresses feel good and feel like something you can overcome. So it's going to lead to this existence where life is just hard and crap and not fun, and there's nothing to really motivate you other than just going through the motions. And when you put that testosterone in there, and then you encourage them to go and now go, oh, okay, you've got the foundation fixed. Now I want you to go out and do all these things. All of a sudden, all these things that used to make them feel crap, or they'd go to the gym and like they'd be intimidated by everyone, and working up a sweat would make their heart pound. They'd feel anxious. They'd be intolerant to exercise. All of a sudden now, they're not going to go in as alpha Chad and just start, benching 3 plates aside and, starting fights in the gym. They're going to go in there and go, it feels good to be in my physical body. It feels good to move. And then this is the start of this therapy where we can go, okay, we've made this biological foundation intervention, and now you can kind of move through that period of your life and become who you want to be. And that's the biggest one, particularly for these younger guys, man, who are under 30, who, they're missing the prime of their lives because they've got this low testosterone environment. They're not getting to turn into the man that they were meant to be.
And that's the shame. And I think we're finding them younger and younger now coming through. I know one of the videos that it will be on YouTube that we've filmed with Dr. Eberwein was about, can men in their 20s go on TRT? What are the causes of young men in the 20s having low T? So that's something we'll put up so if people want to watch it. That's a very good point. And it's part of the mental health thing, anxiety, depression, and it seems like there's an epidemic proportion of this leading to worse outcomes. Where men sometimes they have to call the Samaritans or worse, right? Where they're not always getting the help that they need. Samaritans is a helpline for men that are feeling suicidal, or women, or anyone who's feeling suicidal or depressed in the UK. So if they have those thoughts, there are groups that, like you said, that will help them. But if you can catch it early, and TRT can be part of the solution for many men.
Hugely, absolutely. And men tend to like to look for permanent solutions to temporary problems, which would be, looking at something like suicide for an issue that they're having in their lives. And I think that that's the most important thing with getting this blood work done because, I mean, there are different circumstances, of course. Like if you've got low testosterone because you treat your body like crap and you live like crap, then that's on you. But if there's an issue biologically, that you don't know about, and you're going through your whole life just down on yourself because you don't respond well to things, everything feels like crap, life is just hard, you can't maintain a relationship, you're always stressed. I mean, you're going to feel very, very powerless. And I understand why people go towards that solution because they go, there's nothing I can do, life is not going to get any better. But then if you look at your blood work and go, hang on, I have got the testosterone of a 90-year-old woman. And then you can go, okay, well, maybe if I fix this, then now I can kind of rebuild and get my life back together, and that's amazing. But the problem is that they don't find that out because the doctors don't look for it.
No, that's the real shame of it. When that's why we're happy to be able to make awareness through this channel, and through the clinic, be able to help and treat men who have low T. So finally, the last one, and it touches on actually one of the first reasons why men start TRT, would be sexual function. So we talked about libido in the beginning, but sexual function also has to do with the functioning of getting erections essentially. And we were talking earlier that TRT doesn't always fix those erections, especially if there's like a vascular problem, something causing an issue with maintaining an erection. But many times we know that testosterone can help. I mean, there are men that before they put on testosterone are given Viagra, Cialis, tadalafil, sildenafil, and find that it doesn't work. And we know from the studies there's a certain threshold at which testosterone needs to be at in order for those PDE5 inhibitors to work. So what are your thoughts on that? And do some men maybe just need to be on tadalafil 2.5 to 5 milligrams daily when they're not, those erections aren't necessarily coming about when they're on TRT?
Yeah, I think that, obviously there's like injury to the penis, injury to the vascular system, and so forth. That's separate. But I think a lot of particularly younger guys who are dealing, because I primarily deal with younger guys. I mean, I'm 29, a lot of my clients are under 25. And one of the main things that these guys are having issues with is psychogenic, erectile dysfunction, performance anxiety. And as someone, I mean, I'm very open. I experienced this myself when I had low testosterone, absolutely, because sex is a very vulnerable exchange between two people. And, especially if you're someone, and this wasn't a part of who I was and what I did, it just didn't vibe with me. But if you're someone, who let's say is, going out to clubs and picking up chicks, and you're having that intimate experience with someone who you don't even know, it's a very, very vulnerable exchange, which should make people, feel a bit nervous and uncomfortable. Absolutely. And you've got the pressure to perform, you've got someone seeing you naked who you're into. Like, there's so much that goes on with that. And if you don't have that testosterone there, if you don't have that masculine sex drive to drown out that insecurity and fear, that shit's going to get the best of you. You're going to get a stress response. The blood is going to divert away from the extremities in the body, and you're going to have a flaccid penis. And this can cause a very vicious cycle because when you're looking at sex, I mean, it's something that most people get very excited about. And the difference between an excitement and fear is just context. So, for example, like if you've got two people going on a roller coaster and one loves roller coasters and one absolutely hates roller coasters, they're both going to get butterflies in their stomach. They're both going to get that feeling of anticipation. But one associates that with awesome, good times. The other one associates that with shitting myself, I'm scared that I'm going to die. And this can happen with sex as well. I mean, if you're getting that excitement, arousal, all that stuff that goes with, having sex, particularly if it's a new partner, and if you're going to associate that with embarrassment, humiliation, whatever you take from, losing your erection, particularly if the other person doesn't respond very well, then that can create, again, this vicious cycle where you're getting this psychogenic erectile dysfunction, this fear of failure. And because you don't have that high level of testosterone there just to drown that out, it'll get the best of you. Absolutely. And that's why when you put these guys on TRT and then all of a sudden they go, like, you can still have that, of course. It doesn't make you impervious to being vulnerable, because being vulnerable is a huge part of intimacy. But what it does is you have this like masculine sex drive there, this kind of lust for whatever you're into, and that will drown that out. Particularly if it's like, if you maybe, you're not, watching porn and not jerking off all the time, and you've got like a really healthy sexual charge. I mean, that voice is drowned out. But so I think when it comes to using stuff like, the tadalafil or the sildenafil, I prefer tadalafil. I just find that it works better for guys. You don't have to time it. There's less side effects. Um, that can be a really good band-aid to go, all right, bro, like, you're going to be good, but just so that you know that you're going to be good, here's something for this. And I don't like the thing with tadalafil is in terms of how it works for that psychogenic stuff, like, it's more going to give you like a stronger, fuller erection so that you feel more confident in what you're doing. It's not going to make you impervious to, insecurity and that kind of stuff. But if you feel a stronger, inflation and engorgement of the penis when you're erect, you're going to have more confidence going into that exchange. And I think that that can be really, really helpful for a lot of guys. particularly for the start of their treatment. Maybe they're in a rocky relationship where it's been causing problems, and it's good to get that in there just to resolve that issue in the interim. And then in the long term, yeah, some guys do stay on it. Some guys find they need it. Maybe they've got an issue, metabolizing arginine to citrulline and creating nitric oxide genetically. Maybe, who knows? There could be a lot of stuff going on there. But I like to use it as a band-aid in terms of resolving that. But then some guys need it. Absolutely, it just depends on.
And they stay on it. I mean, and that's some men feel that, well, I'm on TRT, I'm on one medication already. Why do I need to have more? And there's some of that mentality that goes out there. But if it works, and if it is acting like a plaster or a band-aid, as you say, why not? If you're not like you're having sex every day. Well, maybe some people are, but it's usually a very special occasion, and when it does happen, you want you to go really, really well. And you don't want to have, like you said, the negative reinforcement of it not going well to kind of haunt you next time when you do. And so, if this is a tool that can help you, then it helps you. And if you need it every time, so what? So what?
Absolutely, and it's as we talked about before. I mean, TRT is a thing that takes months and years. So you might need it for the first couple of years, and then you might find that after that you like it, you like having something there, but you don't need it. And then as you go forth, you might find that in the long term you don't. So it's we're all at different points in our journey, and I think I'm someone who's not a big fan of pharmaceutical drugs. Like I'm very, very biased against them, but I have no problem using tadalafil personally and recommending it for clients because of how it works in the body and what it does. So if people, need to have tadalafil where they're at now, that's okay. But it's not something that's going to cause you like a dependence or a reliance or a withdrawal. Some people get a bit psychologically hooked on it and think that they can't perform without it, but that's purely psychological. But yeah, I think that if you benefit from it and it's not causing you problems, and I mean it barely causes anyone any issues, then it's what a great thing to be able to have. I say, like, if you've got access to it and it's there and you can benefit from it, enjoy it. Like, why not?
Yeah, exactly. I mean, there are some downsides, of course. I mean, too much tadalafil, it delays your ejaculation, may take a bit longer. You just say to your partner, "Oh, it's all you. I just want you to enjoy it." That's there's ways, and other people don't want them to know. And again, you can just kind of mask it and saying, "I was just very aroused by."
That's it.
Well, that covers the top 5 reasons that we feel that men may start TRT. Again, those reasons were, they were experiencing low libido, low energy, they were experiencing or not responding to their training as you should, and depression and anxiety, the other reason. And number 5, again, sexual function, including erectile dysfunction, are maybe the top 5 reasons that we feel men start TRT. That's it for our video today. Please leave comments. Let us know if there are other reasons why you may have decided to start TRT that we didn't cover here. And again, as always, thanks for watching. Feel free to subscribe, and we'll see you next time. Thanks, Dave, for coming on.
Thank you for having me.